Right. Afternoon, everybody, whether you are joining us live or whether you are watching the recording. My name is Ian MacDonald. I'm here representing Mentor UK this afternoon to deliver a short webinar based really to look at evidence-based approaches to drug prevention with young people. The content's mainly aimed at both teachers working within education, but those also supporting schools and education providers around their alcohol and drug education activities. If you are joining us live, you can use the chat function to send questions. If not, please look at the Twitter details on the screen there. We have both the Mentor UK Twitter handle and also the Mentor International Twitter handle. So we can hopefully continue those questions after the session ends too. And please, if you can, remember to include the hashtag MentorCPD17, and that way we'll be able to track any questions which people have and also the responses which we'd hope to send out to you all. So if we make a start, what I would say is as well, if anyone who's interested in finding out more about Mentor, you can find the Mentor UK website is just mentoruk.org.uk, and for those of you outside the UK, you can visit mentorinternational.org, and hopefully you'll find there that we seek to do as an organisation both within the UK and internationally. And hopefully, and you'll also find some of the resources which I'll be introducing you to this afternoon. So what I'll look to take us through the next sort of 20 minutes, half an hour or so. One is look at why we need to think about evidence-based practice within alcohol and drug education in schools. We'll look a little bit about what the evidence says. So what approaches do we know are effective, as well as those which we know are not effective? Those are just as important. And also look at a couple of examples of how we can seek to bring that evidence base into practice. So how do we actually take what we know and put that into schools, and how do we support schools to be able to deliver it? So we'll start off just by thinking around, well, actually, why do we need that evidence base? Why is it important, and why is it something that we need to consider? Why can't we just take an interesting quote or an interesting program off the television and use that as an activity in and of itself? Well, first of all, we need to recognise that prevention activities are far more cost effective, both in terms of financially for local and national governments, and also sort of socially as well, in terms of the benefits that we can gain through effective drug and alcohol prevention go beyond just outcomes related to alcohol and drug use. These benefits go into the realms of life skills and wider skills which young people need to thrive and take active parts in society in later life. There are some wider factors which mean that any activity needs to be justified in terms of the spend, and that's not just sort of local and national government, but increasingly that's the same within schools themselves. So if we know, and if a school knows that a way of working is effective, they're more likely to buy into it, both in terms of time, effort, and ultimately financially too. The slight issue we have is that some of these prevention activities are harder to evidence than treatment. So actually showing that we are stopping something from happening is harder to prove than by waiting for something to have happened and then trying to impact on it. However, we do need to know that the interventions that we do, so the education that we might offer to young people within a classroom setting, are not going to cause unintentional harm. And that's a real key consideration, and one which can sometimes be lost. And that's where the evidence base can actually help us to know, well, actually, these activities, this way of doing things is less likely to bring about that harm. We also need to know and reflect that the specific needs of young people are very different to those of adults. And so just lifting what works in an adult setting and doing that within a school is far less likely to have impact, because the way that young people work and think and process information is very different. So we can't just lift what works in an adult setting, and just because as adults we think something might work, we can't just put that in without it being properly tested. And so therefore we do need to know what works for young people, and just as importantly, why. And that's really where we're coming from in terms of why is it that we need this evidence base. It's so that we know that what we do, what we offer, what we support schools to deliver in the classroom to young people is the best quality that it can be. And so when we think about what works in alcohol and drug education, some of these things here are taken from a recent Mentor Adepis paper, which you can access by clicking the link there. But we know that the most effective ways of delivering alcohol and drug education to young people are providing regular structured sessions. So not just these one-off activities or maybe one-off days where alcohol and drug education is covered, something that's regular, that's what we call spiral in its nature. So it builds on the skills, it builds on information, so that young people learn about not just the information but also the skills that they need to negotiate these life situations. And that's why we know that when we're promoting the development of life skills through alcohol and drug education, again, we're making much more relevant and much more useful links for young people to be able to use. And they can see that actually skills and ways of negotiating situations in perhaps other parts of their lives are just as applicable to a drug or alcohol related situation as they are something around other risk-taking behaviours, whether that be sexual health, whether that be healthy eating, these sorts of things. And what's really important is if we can help young people to assess and manage the risk that might be present in a given situation. And that's where actually using and making things as relevant as possible, and knowing what makes something relevant for young people is really important, because then those activities are far more relevant, and in effect they're practicing the skills that they need to assess what risk might be present in a situation, whether they could be at a party, whether they could just be out with friends, whether they could be on their own, and actually how they can effectively manage the level of risk that there may be. And that leads on to using very interactive teaching methods. So that means moving away from just giving information. Now that can be difficult if, as part of a health education program within schools, there's lots of things to cover. But that's only the case if we're really rigid in thinking just about topics. If we can identify the skills that young people need, we can start having these very interactive teaching methods, and we can create the time to do that. It makes much more sense for us to focus on those immediate consequences rather than long-term risks. Young people, again, will tell us that they tend to know that there may be long-term risks around alcohol or smoking tobacco, for example, in terms of those health, those cancer risks. To focus on what some of those immediate consequences may be, whether that be in terms of their friendships and their relationships, those social consequences, just as much as what those physical ones might be. And then finally, we can think about adopting what are termed social norms to challenge misperceptions that young people have, especially around the numbers of their peers that might be engaging in different behaviours. We'll look at this in a little bit more detail in a few minutes, but again, we know that we can effectively impact on young people's perceptions of what their peers are doing, and that can then have a positive impact on their behaviour choices. We also know that the evidence tells us that what we call multi-component, and that sounds really complicated, but in effect it's what we term whole school approaches are the most effective. And this builds on what the World Health Organization first termed whole setting approaches. But in effect, it means that we're not just looking at what happens within a classroom, we're looking at what happens within the wider environment, not just of a school, but also the local community. So that means we need to be aware of things like engaging with parents, of things like the training needs of staff, of things like wider policy. How do we respond to perhaps drug or alcohol related issues within school? All these need to be thought about as a collective approach rather than in bits and pieces. And again, we can find some of those on the Mentor UK and the Mentor Adepis website. But we can also find some specific evaluated examples of those approaches on the Centre for the Analysis of Youth Transitions website. And again, that's hosted on the Mentor Adepis page. And some of these aren't, and some of these are sort of European approaches and things, and they borrow practice from different countries, such as the Unplugged programme, the Effect programme, and more recently the STAMP programme, which is looking at these whole school approaches in Northern Ireland and Scotland. The key thing to remember and the key thing to recognise is why they are effective in the first place. And that's because they adopt these whole school approaches. They work not just with young people, but just as importantly with their parents. And this recognises some of the things that we know in terms of those areas, especially in the UK, which have high prevalence of young people's regular drinking. These also correlate with the number of young people who say more freely at home. So we know that that works if we can start to engage with young people and parents. They're effective because they adopt an organisational or school-wide approach. They look at normalising those positive behaviours, the behaviours we want young people to adopt, rather than those that we don't want them to adopt. And they can also take into account things like wider licensing laws and things like that in terms of availability and access, especially when it comes to alcohol and tobacco. But we also have wider changing laws and changing legal complexities around things like novel psychoactive substances. And so again, these approaches need to reflect what's going on within young people's wider lives and their wider social networks, not just within school and the local community, but beyond that as well. And so as well as knowing what things do work and what approaches do work, we need to be aware, just as importantly, as those that don't work. So we know that what we term those shock tactics that might, whether they are adopted through posters or advertising or education programs, we know that they don't work. Trying to shock young people into changing their behaviour doesn't really impact on their thinking, predominantly because actually the behaviour that they may be adopting, you know, they may see a group of friends and siblings and wider social networks that they don't actually see those negative impacts happening to. It amounts to what we sometimes hear called health terrorism, in terms of trying to scare people into change. And we know that doesn't work. Just as if we focus on purely information-based approaches without any element of developing skills amongst young people, that's going to be a very limited approach. We have to remember that young people make decisions not just based on, you know, logic, but more importantly for them, because of their brain chemistry and how they are growing up and their brain development, they're far more likely to make more emotional decisions, more social decisions based on the social gains that they can get, rather than just perhaps around personal risk. We know that things like the use of sniffer dogs in schools and drug testing doesn't have those positive impacts for young people or staff for that matter. Indeed, they're more likely to create that aura of suspicion and negative environments where young people are less likely to look to discuss some of these issues or even to seek support should they need it. As we've touched on already, that idea of delivering one-off sessions on their own, not only are they very limited in their impacts, but they can intentionally do more harm than good, especially if we end up raising awareness of a certain issue or a certain substance without giving young people the skills to manage that and to see how that fits in within their life. And we can't do that in a one-off 1 hour session. What we can do is raise awareness and also raise lots of questions that could go unanswered. So that's why we promote that approach of having more structured, semi-regular sessions which show not just show links between topics, but also mean young people have the ability and the time to develop those skills. And so when we look at trying to bring some of that into practice, there are ways that we can do that. And I've given some examples already of programs that are out there that have been evaluated as working, as being successful ways of doing that. But we also need to be aware that that activity needs to be tailored to meet the specific needs of young people within a given school or a given setting. The general approach could be the same, but we might just alter the content of it slightly to increase its relevance. So for that reason, knowing the data and information that's out there about young people and how reliable that is really important. And so we need to know that where some of those resources and some of that data is available at school level, and that could be via schools doing their own surveys and asking pupils. It could be at a local level in terms of local government doing that and holding that information as a way for them to make decisions around services. It could even be at regional and at national levels too. And that's the same whether we're talking about the UK, Sweden or beyond. Some of these things that we can access as well are the European Drug Prevention Quality Standards. The toolkit is linked to there in terms of how we can bring that evidence base and make it work at local level. That's especially relevant for people who commission services to go in and work with young people. We also have the Mentor Adepis toolkit in the UK for schools as well. And that's much more specifically aimed at schools themselves and how they can approach their alcohol and drug education and make those links with other topics within their wider health education programme. And again, those principles are very relevant for the UK environment, but they can also be adapted and used in different ways in other countries too. We can start to build that bridge between what we know works and actually putting that into reality for schools. So we've got two really useful toolkits there which we can be using and we can be sharing within schools. We can also take it really smaller than that, and we need to be not just looking at that hard data, so to speak, but that soft data. So asking young people as well what it is that they would appreciate, what it is about their lives that they might need a bit more help and a bit more support with. And that can be really simple just by going in and engaging and having the time and giving young people the time to discuss and explore those issues, to see how they appreciate not just the content, but more importantly, how they want to receive that education. And we can look at different ways of presenting that as well. So the example on screen there is very simply young people ranking the things that are important to them within their alcohol and drug education, whether that be the legal aspect, whether that be effects of certain substances, school rules, how to manage those risky situations. And we do find that actually it's those things that are most important. And we can also find ways of presenting that information. Once we've asked young people their views, once we've asked them about their behaviours, how do we report that back? How do we present that back to both young people, but just as importantly to parents and the wider school community? And this is an example of that by a programme that runs within England called Mind and Body. And this is a way that we can get that information and get that voice out there, but also use it to inform how we deliver our alcohol and drug education. And again, another way of bringing that evidence into practice is using the practice of social norms. And that's the idea that behaviour can really be led by what we can gain from it in terms of social standing as well. So for young people, that can be about that idea of social acceptance, fitting in, not being seen to be different. And this is the case quite often when it comes to alcohol use, tobacco use, and also other substance use. And so those misperceptions around what their friends are doing can influence their own unhealthy choices around their health behaviours, and also can influence poor coping mechanisms for when they don't feel great. And so if young people think that a lot of their friends and their peer group are adopting a certain behaviour, then that's likely to negatively influence their decision making. So they're more likely to do the same thing. So if they feel that most of their peer groups are drinking alcohol every weekend, that's likely to influence their own decisions because they want to fit in, because they want to gain that status amongst their friendship groups. The flip side is that what we do know is that a lot of young people overestimate the numbers of their peers engaging in these negative behaviours, whether it be smoking, drinking alcohol, and substance use. And if we're being honest, I think a lot of adults probably do as well. So to try to challenge that, we can think of ways that we can flip that on its head, and instead of concentrating on the negatives, we concentrate on the positives, the behaviours we want young people to adopt. Again, this is an example of a local authority who produced some information for schools based on this social norms approach. So rather than talk about the numbers of young people that aren't smoking, they're promoting the numbers of young people that are not smoking, almost as a way to effectively nudge young people into taking that healthier option. And what's really important for schools to consider, if you're able to ask pupils this and get this information, is that when it's presented back to them, whether it be in a classroom environment or a poster perhaps in a display within school classrooms or school corridors, that the imagery is very neutral. And deliberately here, we've just have a general picture of young people. We need to be aware that if we have a negative image there, which could have been of a young person smoking for argument's sake, that could almost distort the message that we're trying to get across, and unwittingly promote smoking rather than do the opposite. So we keep the imagery really simple, and it means that we can focus on the main message. But ideally, what we want to be doing is promoting those positive behaviours. So the majority of young people that are adopting those behaviours, whether it's smoking, drinking, substance use. We can also be thinking about what we can do in terms of engaging parents. I touched on earlier the importance of that. We also need to recognise that they're a very different group a very difficult group to try to engage. But some of that good practice advice can be things like letting them have a sip. Well, actually, that doesn't work. We know the earlier young people try alcohol, the more likely they are to come to alcohol-related harm in later life. So let's try to promote that. We can support them to think about starting open and honest conversations with their children. And that can be not just around setting agreed rules when they are of an age where they're going out and staying out a little bit later and exerting that independence, but also using culturally, I suppose, relevant prompts for those conversations, whether it be TV programs, magazine articles, those sorts of things. We also have to remember that the internet can be good as well as bad points. And again, if we can normalise the good things in terms of finding out information and effective routes of support and a way of having that information at our fingertips almost, then parents can start to explore that with their children rather than telling them either to do or not to do something. And what's really important is if we can help parents to notice when their children might have these sort of stress points. And this could be around, schoolwork. It could be around extracurricular stuff outside of school, things to do with their social or their personal lives. And we can help them to think about what some of those positive coping mechanisms might be. Just more positive activities and promoting those positive things rather than them adopting those more negative behaviours. So that's ways that we can start to promote that. And indeed, Mental UK have just produced, along with another charity called AdFam in the UK, we've just produced a leaflet, a resource to support some of those discussions and to support parents around talking to their children, especially around novel psychoactive substances. And again, that can be accessed via the Mentor UK website, mentoruk.org.uk. And so finally, to finish off and to start to round off this short webinar, really this is one of the things, one of the quotes that I've always liked. It's better to help people earlier. It makes more sense than having an ambulance at the bottom of a cliff. So the more that we can give young people the skills to manage themselves while they're negotiating that cliff, it's much better for those young people than waiting for them to fall and then trying to deal with those issues there and then. Okay, so I'd like to thank you for listening today or watching the recording if that's how you've chosen to do it. We do have a short evaluation. If you can click on that on the screen, that would be really useful for you to complete. You can also find out lots of information. We've got some of the Mentor websites there, as well as to the Mentor UK and the Mentor International Twitter feed, social media feed too. And again, feel free to ask questions just by including those handles, and if you can, that hashtag MentorCPD17. But thank you for listening. I hope you found it useful, and we look forward to you using, hopefully, and thinking about and starting those discussions within your schools around how we can start to best use the evidence base that we have to support young people in school. Thank you.